In part 2 of an in-depth interview with CarePoint Executive Peter Kelly, I asked about the relationship between the Affordable Care Act, commonly known as Obamacare, and CarePoint.
One of the biggest things about the Affordable Care Act is just that, having affordable care for the population, the majority of the people in this country. And I say the majority because, those who won't be eligible are those who are undocumented aliens. But everybody else is going to be eligible for some form of coverage, which they have not been able to get up to now. So, we feel very strongly that the coverage is going to be, in most cases, will probably pay less for hospital care and more for outpatient care to encourage patients and providers to seek care and to provide care at a lower cost level. We feel that that's an important and the right way to provide medical care, not to wait until it's the most expensive hospital care. So that's a very important part of the Affordable Care Act, having more insurance available to a broader part of the population, albeit at a lower reimbursement model. Secondly, we have an insurance plan because, again, most insurance companies today, commercial insurers, they try to figure out ways why they should not pay for your care. If someone's admitted to the hospital, the first thing the insurance company wants to do is figure out how can they deny the cost of that care. It's all about denials. Our model is not that. We want to have an insurance company that will make sure that we pay for the care. We want to align our insurance company, our hospitals, and our physicians so that we're all incentivized to provide the highest quality care at the lowest cost and at the easiest point of access, which is on the outpatient basis. And that's why we have the insurance company. So, we want to encourage our doctors to take good care of patients. So we reimburse them at a better rate for seeing the patient in the office, where, under Medicaid, a physician may get $12 to see a patient for a primary care visit. As a result of that, in New Jersey, has more physicians than probably any other state in the union that don't take Medicare patients. We want to change that model. We want to pay the physicians more money to see the patients in the community-based setting, to encourage them to take care of the patients and keep them out of the hospital, because we'll be paying for the hospital care too. And why pay for high-priced hospital care if the patient doesn't need it, because it's not good for the patient in the first place.
I followed up by asking Kelly what interest CarePoint had in charity care patients as a for-profit hospital.
We are very focused on those uninsured patients, and why? For two reasons. One, as you pointed out, that the future under the Affordable Care Act is really patients having access to affordable, low-cost insurance, a large part of which is Medicaid. So if we can get those patients into our system now and start treating them effectively, we provide primary care, we provide medication, we learn how to keep them out of the emergency room, we learn to cut down on hospitalizations. It's not a model that sustains forever because we're paying for it with the monies that we're generating right now. But once they are insured and have insurance, then that'll be additional revenue coming in that will offset the costs of providing the care, and we think that we can provide the care at a lower cost than the insurance premium will be there. Now, and it's a very important point. I mean, our neighborhood health centers that we're opening up, we'll probably treat somewhere in the area, in all three of our neighborhood health centers, about 30,000+ visits this year. And again, these are all patients who we're keeping out of the hospital. Our readmission, or our return rate to the emergency room for patients now who are treating in neighborhood health centers as opposed to before, we've reduced the ER utilization by close to 50%. The same population before and after in terms of hospitalizations, we've reduced that by over 60%. So we're having a real impact on not just the cost of healthcare, but the quality of healthcare, because the reason they're not coming to the ED, the reason they're not being admitted, is because they're being cared for in the community and they're being kept healthier in the community. And that's really what it's a simple model, and a lot of people don't understand it. They think for-profit. I mean, there's no difference between a for-profit hospital and a not-for-profit hospital. Both systems have to generate excess revenue, enable be able to reinvest into the system, or they have to rely on the government to provide additional dollars. In our case, every time one of our hospitals has been acquired and gone for profit, we have saved the state millions of dollars, because just in Hoboken and Christ Hospital alone, prior to the acquisition, the state over a 3-year period had spent over $22 million in stabilization funds into those two hospitals because they were critically needed in the community, and they were failing. Once they were taken over, the commitment to the state was, we will never ask for stabilization dollars again. So we've saved the state and the taxpayers a huge amount of money.
Finally, Kelly spoke about the vision of CarePoint in Hudson County going forward.
CarePoint Health right now is the largest provider of medical services in Hudson County. I mean, we started in Hudson County. We're committed to Hudson County. We're all about bringing improved health care to Hudson County, the most densely populated, smallest but most densely populated county in the state, with some of the biggest problems relative to disease entities, be it cardiac disease, be it cancer, et cetera. Our whole goal and mission is to expand access and improve access to patients in this county, so that in fact they can receive the health care they need at the earliest possible stage that they need the health care. And preventative medicine and primary care are cornerstones of what we're doing.
I'm Michael Shuren with Hudson County View, the eye of the community.